Hello and welcome to Focus on Liberia. My name is Dennis Jar and we are broadcasting from Atlanta, Georgia. In tonight's edition of Focus on Liberia, I am fortunate to be sitting with a team of professionals, the Liberia Medical Mission. They are on a mission, of course, and they are going to be launching their recruitment fund drive for the mission to Liberia. Joining me for this, I have the co-founder of the group, that's the Liberia Medical Mission, Mr. Joseph Sakor. Joseph Sakor, I have known him for the past 30 years, maybe. Joseph, welcome to Focus on Liberia.
Thank you, Mr. Jha. It's a pleasure.
Thank you. And I want to welcome your team. We are very much happy to have all of you joining me for this special show. At this time, I will call on Joseph to start with his own introduction, and he can allow members of his team to introduce themselves. Again, team from the Liberia Medical Mission, I'm so happy to have all of you. Thank you so much for your time. Joe?
Well, thank you very much, Mr. Jha. It's always an honor to be on this show, a well-respected program all around the world. And thanks for your service to our communities. Again, my name is Joseph Sakor. I am the Executive Director / Chairman of the Liberia Medical Mission. Thank you.
Thank you. At this time, we will go around the room. The next is Roberto, and then we'll go to Dana, and then we'll go to Dr. Condroy. And we just go around the room introducing yourself. And again, let me start from Roberto, and then we go.
My name is Roberta Burke-Williams. I'm the Deputy Director of the Liberia Medical Mission. I've been with the team since the beginning. Joe, myself, and a few others started the mission. And our goal is to really go back home and do the best we can for our people.
Thank you so much. Let me go to Dr. Condroy.
Hi, it's really great to be a part of this program and to be part of the Liberian Mission Group. I've been with the group for the past 5 years. I'm an ophthalmologist, an ophthalmic surgeon. I've been involved with mission work for the past 5 years. I'm currently involved as the senior ophthalmic consultant for the Mercy Ship. And the Mercy Ship is off the coast of Africa now, and it's planning to go to Liberia in a year or two. There's a great need for eye care in Liberia. Over 500,000 Liberians have vision problems, many of them blind. They're suffering from cataracts, glaucoma, pterygia, and most of these conditions can be treated very simply with a 5 or 10 minute surgical operation. So it's really a great pleasure to be part of this team and to help the Liberians in any way we can.
Thank you so much, Doc. Let me go to a medical practitioner among us here, Donna Gibson. Go ahead, please.
Hi, good evening. Very nice to be on your show. Thank you for having us on. My name is Dunia Gibson. I am a family nurse practitioner, and I've been with Liberia Medical Mission. I think I'm the baby here since 2020. Everybody else has been here longer. So I'm thrilled, to be going in 2023. And I look forward to helping my people. Thank you.
Thank you so much. We appreciate it. Let me call on Dr. Patience Green. Dr. Green?
Hi, good evening. Thank you so much for having us. So I am a general surgeon and surgical intensivist. I joined the mission in 2020 as well with Julia. It's been an amazing opportunity. So I'm really looking forward to being able to, in the future missions, really expand the capacity of the mission just to address some of the surgical issues that the country faces as well. So again, thank you so much for having us and allowing us this opportunity to speak about our work.
Thank you so much. Let's call on Dr. Asata Kamara.
Hi, thank you for having us here today. My name is Asata Kamara. I live here in Atlanta, Georgia. I'm a lead nurse practitioner for Village Medical. Village has more than 270 offices or clinics nationwide. I have been in the business of taking care of sick people for almost 20 years. I have a doctorate degree as a nurse practitioner, master as an adult nurse practitioner, another master as a psychiatry nurse practitioner. I've been with the mission. I'm one of the co-founding member of the mission since 2011.
Wow.
Um, so we go back to Liberia and help our people because it's very, very simple. If you don't have stuff, you say, I don't have it. But if you are giving a little bit of opportunity, it's also an obligation to be able to alleviate other people's suffering. Thank you for having us.
Thank you so much. Let's go to Dr. Castaneda. Doc, welcome to the show.
Thank you so much for having us. I am Sergey Castañeda. I'm originally from Colombia, where I did med school, but I've been in the US for the last couple of decades. I'm board certified in internal medicine and also in radiation oncology, and had the pleasure to join the Liberia Medical Mission in 2017, and I was able to participate for 10 days in February of 2018. We got to be in the communities, both inside Monrovia and the periphery, in multiple health centers. And I'm here to support the education and also the taking care of patients on those missions.
Wow. And really, I'm curious, but let me hold that. Like, how all of you got in touch with LMM? But let me go to Dr. Veronica. Go ahead, Doc.
Yes. Hi, I can explain that. So, hi, my name is Dr. Veronica Sagby. Actually, he's my husband. We're both physicians, and I brought him to the mission because he being an internal medicine and also an oncology physician, I thought that he would be able to help. I actually met Joe in 2017. I'm from Venezuela. He and I share our passion for global health and for helping both of our countries. So when I heard his mission, I decided to join the Liberia Medical Mission. I was in the moment trying to apply a surgical supplies recovery program, which means that we try to collect supplies that the hospitals are going to waste, and we were trying to find them a place in our countries. So that's how I met Joe, but I ended up helping to develop the surgical part of the mission in 2018. More education for the surgical department. And our hope is now that I'm a pediatric anesthesiologist, is that we can help in the anesthesia realm.
Wow. This is just amazing. Dr. Simmons.
Hello, hi everyone. My name is Dr. Simmons. I am a licensed psychologist, and I am one of the peeps from the old days with Liberia Medical Mission. I joined in 2013. I am the lead for our mental health team, and I am also on the board of directors. And I'll answer other questions then. Obviously, as you know, Liberia is in dire need for mental health services. So it's been an honor from day one to be able to go to Liberia and help our people with various medical and mental health needs. So that is me.
Wow, this is just amazing. Thank you so much, all of you, for the work that you're doing. This leads me to the first question. What is the Liberia Medical Mission? What is this all about? I know I had Joe and Roberta like 3 years ago. I mean, time flies. So let's go over it, starting with any one of you. I know Dr. Simmons, Roberta, Dr. Kamara, all of you have been with the medical mission, so it's not just you. Tell me, what is this LMM?
Well, we started off making it our business to go back home and help the underprivileged. A lot of us came into this country or different countries up other part of the world, but not everyone was able to leave and not everyone could financially leave. So when we got here and got educated and got our life together, we figured, okay, you know what? It's time to do something for our people. It's time to go back. It's time to give back. And we sat there in somebody's house. I don't even remember who house we sat in. I think it was Joe. And we put the whole mission together in like 20 minutes. It was amazing how everyone just said, oh yeah, I want to go, I want to go, I want to do it. So we had no problem finding nurses and doctors the first year because everybody saw our vision and wanted to be a part of it. And here we are from 2011 to now, we're still all going strong. And our patients still look forward to seeing us every time we come.
Mr. Sacco, you wanna go? I feel like it makes sense that you'd go before we chime in.
Right. And this is very conversational. Let's chime in, everybody. I can see even the
Go
Dr.
ahead.
Veronica, the couple. I mean, they all understand the mission, so anybody can just go and tell me about this thing. I'm excited.
I'll be the last.
Okay.
I'll just say, from our perspective, I thought Ms. Roberta said it very, very well. What I will add in terms of our vision for LMM is that we would train, we would educate, and we'd advocate. And that's been kind of our pillars from the beginning. And we were able to solidify that a little bit more around 2018-ish, kind of put it in writing in terms of what is it that we do. We train. So when it comes to training, it's not just our goal is to train other practitioners, because when we're not there, it's about sustainability and continuation of the work that we started so that there's not an absence. Once we're gone, we're gone. And when we talk about educating, it's more about educating the patients and the people that we serve so that they know, for example, in my case, I train both providers, mental health clinicians, but also educating patients about what their condition is. It's not that, oh, you crazy, oh, that just zoko, oh, that this, that, and the other, but rather that these are individuals with actual mental health conditions. We know that Liberia has gone through civil war, and a lot of people struggle with post-traumatic stress disorder. We've got a lot of trauma. Most of us are functional, traumatized people, but just being able to educate in that way. And then the other piece around advocacy, again, is to be able to go out there and talk about the importance of, being proactive about your health, both physical and mental health. So those are the three pillars that we stand on. I just wanted to add that piece.
Thank you. Joe?
Yeah. Okay.
So when you say mission, yeah, Joe, go ahead, because I the questions just coming to me, but go ahead first.
Okay. So I think both Dr. Simon and Sis Roberta, have said it eloquently. What I want to add, to those beautiful statements that they made about Liberia Medical Mission is that we are community-based 501c3, and we are like a family. All right. Trust me. All of us here, we are aware of one another. We are aware of one another's families, and not only do we do all of these great things that we do in Liberia, but we are aware of one another. We care for one another. So the whole idea behind the creation of this Liberia Medical Mission, because we want to be a medium, okay, through which other Liberian professionals, health professionals, can contribute towards the reconstruction process of Liberia. Okay, we know our country was once considered as hope for a lot of people, especially those that in the neighboring countries prior to the war. Okay, so we have made our business to come together to contribute in the reconstruction of Liberia and improving the healthcare delivery system of that country. And with the participation of all of these wonderful individuals that you see here, and many more that could not be on this forum. we are making a headway.
Thank you. And I want to go to Dr. Veronica and Dr. Sigwe again, because as you say, you're from Colombia, and you. And I don't want to sound like okay, what are you doing here? But you should.
What are you doing here?
Right. It's like Colombia also needs you. So just give me a little background as to what interests you about being part of the Liberia Medical Mission.
I think I can start by saying that I was moved by all the testimonies that I heard from Joseph when I met him. And then when I met the rest of the team, I was really inspired how caring they were, how they really wanted to give back to their own community. And I do share the feeling because that's how I feel about my own country. Being that said, I think we were very situated at the moment to participate in that particular mission. And since then, we'd like to continue helping future missions. So it's more about helping fellow human beings as opposed to where are you from, how do you look like, and what are you doing in this planet. I think all of us need to help each other. And definitely the Liberia Medical Mission has resonated with us. And we're thrilled to be part and try to help. I do have a dream. It's I do know that Liberia was very vibrant within the medical community of West Africa back in the 70s, with a lot of promise on developing lots of resources for the region. Unfortunately, many things happened decades ago that put the country behind and struggling to provide care for very simple medical conditions to the more advanced and difficult to treat. But I do hope that in our lifetime, we bring back radiation oncology, which is a vital part of taking care of patients with cancer. So it's not only the surgery, the chemotherapy, but radiation oncology is part of being able to cure and treat patients with cancer. So that is available in other countries in West Africa and Central Africa. And I'm hoping that if all the moving parts come together, hopefully we get to see that it's a reality again in Liberia. So if I can be any part of that, I'll be extremely happy to.
Excellent. Dr. Zobi, Dr. Conrad, same question.
Well, for me, I think because I share this passion of global health with Joe, as I said, it's not only about Liberia, it's about helping, like other countries. When I send supplies to Venezuela, to Peru, and Liberia. And my hope is that creating a curriculum for education can be shared into many countries. And so for me, when I went to Liberia, it really touched me. See that people suffer all around the world. It's not only in our own countries. So I really share that passion, to help other people. And I hope the knowledge that I have been able to gain in the United States, training here, and the lucky that I have been to train in a great place, I can actually share, in other countries that need the education resources.
Wow, thank you. Dr. Kandra, can I add anything?
Yes, like Liberia has always had very close ties to the United States. I was introduced to the Liberian Medical Mission via C International. They were looking for an eye surgeon to help with a mission to Liberia. And that's when I met the Liberian Medical Mission team. And immediately I felt the love of the team, the community, as Joe Sacker stated. And it's just a tremendous opportunity as an eye surgeon to really make a difference for the Liberian people. Blindness is very devastating, and it's really heart-wrenching to see the blind Liberians with these conditions that can surgically be corrected, maybe with a 10 to 15-minute operation.
Wow.
Also, it was really disturbing to me because many Liberians who are blind, they need a child guide. So there are two people essentially taken out of the society the blind adult and the child that has to kind of lead them. So when you do have a successful surgical operation, you're liberating two people that can be functional members of the society. So all of my missions have been extremely rewarding, and it's an honor for me to be here with the Liberian team and to be part of this wonderful group who I feel are really making a big difference in the country of Liberia.
Precisely, definitely. Dunia and Dr. Green, I know you said you think 3 years is small, but that's a long time. Tell me about your experience with LMM. Have you been able to travel to Liberia or anything? Just lay out there for me. Dr. Green, let's start with you.
Yes,
Okay.
I was able to go on the last mission in 2020. It was an amazing time. I actually happened to come to know the team while I was in Liberia previously, actually with another mission. So my family's actually Liberian and traveled to the United States, obviously, to escape the war. And so it's always been very important to me to make sure that when I became successful here, that I was able to go back and help in any way that I can. And pursuing medicine that really allowed me to do so. So actually, met the team previously during another mission. So the last mission was, it was a wonderful experience. Just being able to go out and to know that you're feeling a need and really making a difference in the lives of these people, these our fellow countrymen, right?
Yeah.
And then being able to take what I've learned from here that sometimes we may take for granted. Obviously, access to certain basic things like a $5 blood pressure medication you can get at Walmart isn't as readily available, right? So being able to provide access to that, but then also expanding that, like Dr. Sogi mentioned. So what can we do now in the realms of surgical diseases, such that we can also help in other areas, even just beyond primary care? And so that's really where I come in at. So I'm a surgical intensivist general surgeon, also being currently undergoing additional training to become a trauma surgeon. There's so much need there, and I really look forward to being able to help one with the trauma surgeon, the trauma center at JFK that they've been working on, but as well as establishing a collaborative relationship. It's not just, oh, I'm just going to come there and I'm going to teach you. Well, what can we also learn from them? Because our counterparts in Liberia do great work with what resources they have, right? And we may take things for granted when I can go into the operating room and have blood available, have a ventilator and things like that for our patients here that may not necessarily be available in Liberia, yet they're still managing to take care of their patients, right? And so, in addition to going and helping to train and providing care, but also learning from them such that we can make the healthcare system there that much better for everybody.
Thank you. Dunia? I'm
Yes,
sorry if I'm not pronouncing that correctly.
it's okay. It's Dunia.
Dunia, okay.
I was privileged to join the Liberian Medical Mission in 2020. I met Uncle Joe. He convinced me to come. It wasn't a lot of convincing to do because it's always been my passion to help people. I've been a nurse now for about 15 years and a nurse practitioner for 5 years. But out of those 15 years, about 10 of them I have worked in low socioeconomic backgrounds. So I want to help the poor. I want to help people from backgrounds that don't have access to healthcare. So right now I do it in New York City. Um, my patients that I have in New York City remind me so much of the patients that I met in Liberia in 2020. The only difference is here, although they have access to care, but mentally it's not there. So while helping people in Liberia it's always been a dream of mine. I'm happy about that. But there's, like Dr. Green said, a lot of chronic illnesses that's not being met. Like she said, common medication that you could get from Walmart is so far available for those patients to get. So just going and bridging those gaps, teaching patients about how to treat your diabetes, how to treat your hypertension, your high cholesterol. It's always been a dream of mine. And I'm just privileged to be on this mission and to be going with these wonderful people again. Thank you.
Thank you. While in Liberia as a child, I remember that you have a sibling who goes to the clinic and bring the tablet, right? And all of you are sick. So here's medication. We all share it, right?
Mhm.
So when you say a medical mission to Liberia, and I know Dr. Simmons touched on that a little bit, what is it that you do? Because what we see is sometimes you go, you take a truckload of medicine, deliver, and come right back. So when you say medical mission to Liberia, what exactly is it that you do? Is it going
Okay.
there, throwing it there, coming back, going in, and then the people go right back to the same thing? What does it look like?
I think it's good to keep in mind that we're working with for most of us, it's a third world country, so things don't always go as we envision. Looking at our chairman and chair lady, it don't always go as we envision because we have a beautiful vision. For those that are like the core team, we're like, all right, this is how it's gonna go, and then we get there and we're like, okay, we got to tweak some things. I, I will let Mr. Sako answer this question, but I just wanted to lay this like overarching theme as I listen to everyone say their reason for being on the mission. Um, if it hasn't shown through, I think one of the biggest things that you can see is passion. That everyone has this deep passion for humanity, regardless of the country we're from. So if there was a mission to Venezuela with Dr. Zogby, I'd be right on it, right? Because it means that there's someone in need that we can help in some way. So all of us, what binds us, I believe, is our common passion for humanity. So I'll turn it over to Uncle Joe, as we lovely call him, or Miss Roberta, to kind of talk about what that looks like, and we can chime in the mission itself.
Okay. Well, thank you so much. That's what I love about this team. The good thing about this team, when you have so many smart, hardworking people at the end, and you just relax and take all the credit. People praise you, but they work behind the scene. So I am so thrilled and I humbled to be working with this amazing team. So when people hear about Liberia Medical Mission, let me just tell you, it is broken into three functional areas as we go into this mission. Um, so on top of that three functional area, we also going to talk about, we're not talking about the logistics for organizing that mission. First, we have the what we call general medicine, which has to do with a surgery. When I say surgery, sometimes we do minor surgery, hernia repair, seeing patient in an outpatient setting. Um, we also, that's one piece. All right. Our chief medical officer, which is Dr. Sila, that works in Atlanta, Georgia, he oversees all our medical operation. The second component to the mission is that of the eye care, which is a big one. That is headed by Dr. Achima Major. She's the lead person for that. Under the medical care, we do cataract surgery. We also distribute reading glasses. The last time we went, we carried about more than 3,500 reading glasses and distributed to our patients, even those that we saw. So far, we have been able to do close to, thanks to Dr. Conrad and all the other volunteers, we have been able to do close to 300 give. We have provided a gift of sight to nearly 300 Liberians. Okay, that is a great news. Another important aspect is the mental health. I know Dr. Simmons is going to be talking about probably. So the mental health component, many a times we try to overlook, but there is a huge need. And within that mental health, we have been able, through the leadership of Dr. Simmons, we have been able to at least conduct workshop for the national police in Liberia. We also been able to partner with our Carter Center in Liberia and JFK, and other institutions, going to schools. She has done extremely well. And on the general medicine as well, thanks to Dr. Zagby and all the other, Dr. Kamara, Donia, all our nurses that have been participating in our mission. So they have been providing education. Not only do we treat our patient, but one important thing to note is that we've also been providing education to our patient, how to manage their diseases. Okay. There's one thing, Aliza, to just give out medication to a patient. And there's another thing to tell them, okay, yeah, this is how you need to do if you want to still healthy. Okay. We also have been doing that. The other part is that the distribution of medical supplies. Liberia Medical Mission has been able to provide more than 13 million US dollar worth of medical supplies to Liberia as part of our contribution. Okay. Sometimes, people don't say it, but it is worth mentioning that the team that you see and other volunteers around the world, we have been able to at least to impact so many lives in Liberia. Okay.
Joe, let me stop you shortly. You say $13 million worth. What is
13
that?
million US dollar worth of medical supplies and medication. That
Wow.
is, we do not take into consideration the professional services that people like Dr. Condra, Dr. Green, Dunia, Sata, Dr. Zagri, the professional services that they render to the patient. This is just the medication and medical supplies. Okay. Now, another thing that we started doing, our biomedical engineer, we carry biomedical engineer. So we liaise with various institutions like JFK, so that if they have some of the diagnostic equipment that is sitting in the hospital, like dust takers, they are there, and it costs a lot of money. But because they need to import experts to come and fix those something, so we have our own biomedical engineer that travels to us, a Liberian that has more than 2 decades of professional experience, under his belt. Okay, so we tell them, give us the serial number. We take this biomedical engineer and repair that for them free of charge. So that saved those institutions a huge amount of money. That's what Liberia Medical Mission has been doing. So it's worth mentioning all of these things. Okay, so I'm going to stop there. Maybe my colleagues will add up. Thank you.
Wow. I also want to mention that while you do this, it looks like you also have some fun. Look at the beach.
Yes, we do have some fun.
That's the last day.
Yes, we get there. Like for instance, my job is to, when I get the application, I say I want to go. My job is to get them on the plane, from the application to on the plane. And let me tell you. And then when we get there, my job is to make sure they have a place to stay, they're eating, they're safe, the car didn't break down on them, they're not in the middle of the road somewhere. And the young generation does not stay out late, and I don't know where they are because now I'm starting to worry and everything going, So when we have that time to go just take off, we do. And a lot of time I have to pull people aside and say, look, you're a little bit too stressed. Why don't you go on the beach and walk a little bit? Why don't you go in your room and take a nap? So, and that happens as well, which is a good thing because I don't want burnout. I thought I turned this thing down. We don't want burnouts. And these doctors are taking their own time, why can I not turn this thing off? Sorry about that. They're taking their own time, their own money, their own everything to go. All I need to do is say, okay, no, you cannot go over to that place today. And that's all we have to eat today. I'm sorry, So I'm like Dr. Simmons said, Mommy Roberta, because it's like after a while, people think I'm everybody's mothers, which I like that title. But yeah, we do a lot, and we do a lot within 2 weeks. So we have one day off, and that's Sunday. So that Sunday, I want to make sure the group have a good time.
Yeah.
We look for the beach, we look for a restaurant, we have a party, or we just sit around in a hotel and do nothing, because we need that to refuel and regroup next week coming up. So and people forget that we only have 2 weeks. It's
Within
only
2
2 weeks
weeks.
there. And we do so much in that 2 weeks. People be like, you sure you want that a month? Nope, 2 weeks.
I want
Yes,
to add everything that Roberta does is only even before the trip because remember, it's also our visas, the licenses for the physicians to be able to work there. It's so much work what she does in preparation, and we really appreciate it, Robert.
Oh, thank
thank
you.
you. And that brings me to the question of who really goes on this medical mission? Because Joe is not a doctor, I know that. Roberta is not a doctor, So who can go? Is it okay? Let me give you my background too. My background is health informatics, so I work between doctors and technical people. And right now, I'm a journalist as well. Do you need me? Who are some of the people that make up this mission? Tell me.
We need everyone. Health
Yes.
informatics is great because we need data, and we need someone to set up how many people are we in fact seeing, what's the most effective way to see them, the workflow efficiency, and all that good stuff. So I think it's open to any and everybody. Clearly, our chairman and chair lady are not in the medical Well, Mama Robbie's, but we get it. They're not physicians or psychologists or surgeons, but they do an awesome job and they are our leaders and we honor them in those roles. But anyone really, because we need folks to help with transportation,
Right.
we need people to
Logistics.
help with logistics. So I had two of my friends come one year, and they help with organizing people, Onyx and Jetta, or organizing people when we went from one village to the other, and so forth and so on. So we are truly one big happy family, and we welcome every and anybody that want to help.
Right. And because
I
when
And
just
they
you're
want to
don't
add.
they don't want me to drive.
No, we do not want
I
her to
just want
drive,
to.
so we need a
Yeah,
driver.
I just want to add. I just want to add a little bit to. That's a good question
no,
because
no,
we
hold on,
usually
Joe.
get.
Dr. Kamara wants to add something small.
Okay, sure,
I
sure.
think
Go ahead.
Well, I think Dr. Simmons said something, the passion. I remember my first mission in Liberia, 2011. I had a 3 months old baby. So I employed somebody. I think at that time we were there for 3 weeks,
Yes.
Yeah.
24 hours, not even thinking. And then I resigned like my second job because they won't give me time off. I resigned that job and I said, I'm going to go. And I'm glad that I went. My life will never be the same again. The only reason that I missed the past two missions, but I went solo to Nimba, San Nicolas, and Ban, was because of other obligations. But the thing here is, for me, when I'm in Liberia, I am more focused on prevention. Prevention. I don't want people to take stroke. I do not want people to take heart attack because what we're gonna do? The minute when you look at some of our family, and one thing Dr. Green said, like I have learned so much by going on this mission from the Liberian healthcare workers.
Yep. Yeah.
I've learned so much from them. Like this time, the doctor I was working with, Dr. Kamara, he's in Lanco. I learned so much from him, taking care of typhoid patient. And then I'm asking, and he's also the nurses were also learning from me. They would ask me, why you want to please everybody, you know? And I'm learning from them too. So it's just amazing. So even here in the state, like a couple of weeks ago, I purchased a blood pressure machine for one of my patients. The medical assistant said to me, really, Miss Kamara, you spend your money to buy a machine for the patient? I said, okay, wait a minute. I just spent $36,000 when I went on the solo mission, $36,000 to supply all the medications. Okay? So what about a great United States that afforded me all this opportunity? I say for us, it don't really matter. You blue, you green, you yellow, it don't matter. Our reward and payment, if this person is feeling good, their suffering is alleviated, you get your pay.
Wow.
That's it.
That's right.
Let's go to this 2023. You have a mission to Liberia, right?
2022, yes.
2023. Let's talk about that. When are you going? What really the actual mission is? And I was also curious to know how you get people from these different backgrounds. Okay, is it based on what you see when you're there to say, okay, when I go back, I think I'm going to get an eye doctor. Okay, this time we are getting these cases, so we're going to do this. How do you figure this out?
Well, we depend heavily on the Ministry of Health for their report on what the needs are in the country. I remember our first year, the need, it was our second trip, the need was baby bottles. So everyone did a baby bottles fundraiser, and we took over, I think, 4,000 baby bottles to Liberia. And we distributed them to different babies feeding centers. So we rely on them to tell us what their needs are. Well, we know in Vergemont they have this. We know in Basa they have that. We know in this thing they have that need. So we use that to get to apply for medication, to apply for supplies, to apply for pain pills. We go by what, and then also we also use the worksheet that we came back with. Say, well, we came back. We have this new illness that there now that wasn't there in 2011 or 2013. So now, what do we do about it? Let's see if we can get medication for that one. And then we have these real cases that it's not a short-term fix. So what I do is I call a few doctors on this end and say, here's the picture. What do we do? And they will tell us, okay, there's nothing we can do, or send the person to Ghana, or send something. And sometimes we collect money together and we send the person to Ghana. We have done that so many times. I remember the first trip we ran into the woman that at a church. Her high blood pressure was so high, we were scared she was going to pass out right there. So we all just kind of rallied around each other, collected some money real quick, and put her in a cab and took her to the hospital. So we do things because it needs to be done and because we want to do it. We genuinely want to do it. So when we get ready to go to Liberia, we know we're taking medication for XYZ. We know we're taking XY parts to fix XY machine at JFK. We know, there's baby medication that we can also pick up. We know, so we already have our list of what we need to bring with us. So we try to our best to get it and bring it with us. And the group would tell you, we all put money into buying pain pills out of our own pocket. We have pain pill drives. Yento will tell you, Yento is excellent on that. She will collect painkillers. She would have a whole suitcase full of painkillers, So we collect those things individually as well. So when we get home, when we get to Liberia, when I say home, I'm talking about Liberia. When we get home, we are ready. We are ready. We just need our car keys and a clinic name.
Okay.
Thank you. So let's go to this. Okay, go ahead, Joe. We want to talk about the mission now for 2023. What is it going to do? And,
right. That's what I want to touch now. So for Mission 2023, like we usually do, again, we are carrying, we'll be focusing on 3 main areas, like what Roberta said, based on the needs from the past mission. We have begun to recruit people in those specialties. All right. For the eye, Dr. Major and Dr. Conrad they are helping in that area. So there were few surgical cases that were presented. Dr. Green, and we'll look into the possibility of recruiting, some surgeons for us that will probably do minor, non-complicated cases because of the duration of the mission. And we also want to focus largely on education. There are volunteers that have reached out to us. Some of our volunteers are professors, assistant professors at different universities that we would like for them to either go to University of Liberia, Douglas College of Medicine, at least to provide some lectures and stuff like that, or to go to TNIMA if they are nurses and Ps. while they are serving the clinics. We also want them to serve some time. We also, like, what we usually do is to pair local nurses and local doctors with our visiting folks like Asata and Donia, and patient. All of those people, we identify individuals that are interested in volunteering. We'll say, well, let's exchange. Like someone, like Asata said, we have gotten a lot of positive feedback from that. That yes, we have learned from them. They will ask question, why are you doing X, Y, Z? They will explain to them, and our visiting nurses and doctors will also ask them, why are you doing this thing? This is how the local, policy and protocols that we follow and stuff like that. So the mental health, Dr. Simmons has been very good. She's recruiting, team. Every team lead is recruiting individuals in those areas. All right. Dr. Zachby did extremely a nice job the last time with JFK, but providing training for some surgical team at JFK. Out of that mission, we got a lot of feedback from our JFK, from the surgical department at JFK, which we appreciate, and I want to continue, that as well. The other thing that I want to do for 2023 is that we'll continue the biomedical aspect. Our biomedical engineer, we will contact a JFK, Redemption, and other hospitals if they have any need, like medical equipment repair needs. They will reach out to us, to reach out to Liberia Medical Mission, and give us, okay, yeah, this is what we need. Okay, so, and Dr. Conrad rightly mentioned, because of the limitation of our time in Liberia, we have a local ophthalmologist. Dr. Gizi has been very helpful, and other people. We usually pre-screen our patients, so that when our surgeons get there, we know that, okay, yeah, this is a good candidate for cataract surgery. So they are ready to go into action, because our days are numbered the moment we arrive in Liberia. Okay, so basically those are some of the things, and I will also leave it with some of Dr. Seymanu's lead, and Dr. Conrad to also chime in from their respective areas as well.
And so I know, Dr. Kandra, you're going to be going, Dr. Zagbi, Dr. Castaneda, Dr. Green. Tell me, what are some of your expectations? What's going to happen? What are you going to do? Even preparing for the trip, how are you preparing, and what do you expect? Dr. Kandra, maybe you go first. Yeah, Dr. Kandra was having some internet issues.
Mm-hmm.
So, Dr. Green, you want to go?
So basically for this next 2023 mission, in addition to like the primary care and the clinics and things like that, we're working and we're reaching out, collaborating with our colleagues and our stakeholders actually in Liberia in terms of what the needs are. And so far they've identified a few. So now we're working on our end to see how we can best meet that need, and if it's feasible within the scope of the mission. Like Uncle Joe said, we don't want to do anything that is too extreme, because we want to make sure that we're there to provide all the care for the patient. So you don't want to do a major surgery or major operation, then just leave them, right? And so we're working now, hopefully being able to not only provide education for the surgical providers and anesthesiologists and then nurse anesthetists within the Liberian healthcare system, but also working to provide management for a lot of issues that have been brought to our attention. One of the most important of which has actually been fibroids. And that's a huge burden for women in the United States as well. For women of color, period, fibroids are a major problem, and significantly so for the women of Liberia. So now I'm working with collaborating with gynecologists here stateside, as well as finding out what our capabilities are, what are the needs, so that we can find the best treatment plans for these women to make the most good of the time that we have during our mission. So I don't want to go promising X, Y, and Z, but just saying what can we feasibly do to make a difference within the scope of the mission. And so that's what we're working on now, is actually talking and collaborating with the stakeholders on the ground. Well, what's in place? What resources do you have? What medications do you have access to? And then what would we need to bring in terms of medication birth control, hormonal contraceptive, things like that to help in addition to any surgical procedures, in addition to any gynecologist to perform those surgeries as well. So that's currently what we're doing now prior to the mission, hoping to have something in place for the mission come February.
Dr. Castaneda, Dr. Zoe, I know, I mean, and if you as a couple going, I mean, people will say, well, I mean, what is it you're doing? At least one person go. Who's going to be here? So what are your expectations? And when you get to places like Liberia, where everybody wants the world, how do you manage that expectation so that you are not under delivering and disappointing the people? Oh, I was expecting this. And the need is so great, is so that how do you feel that, okay, I might be able to meet their needs? Did I fall short? How do you mentally even prepare before going, and what are your expectations when you get there?
You want me to go first, okay? Yeah. So for me, the first time that I went to Liberia, actually I brought Sergey because he's an oncology. He does radiation oncology, but he's also internal medicine. So he has two specialties. So I thought he would be very helpful in helping me do a need assessment because our goal was to set up an oncology program in Liberia. But when we arrived there, we realized that people are dying from basic needs. So it's very difficult to treat cancer where they're dying from very simple diseases. So that's what we were trying to, and I talked to the med students and to the residents in JFK. And then we realized that there's a lot of things that we need to do first before trying to implement an oncology program that, as Sergey said, is hopefully going to come in the future. We already started conversation with the JFK people. And as we were saying, we're here to provide them with what they need because they are the physicians in the ground and they're the ones that know what their people need and what are their own needs. So we're there to supply them with surgeons if they need to do consults, education material if they need to, and also helping them deliver their own needs. Like the JFK were trying to place a CT scan that I think they already did. But we realized that we couldn't treat cancer if they couldn't stage the patients, right? So we have to go one step at a time. So for me, my expectations are that every year, every mission can be better. One of the things that I realized was that when I screen patients in the clinics, when in the villages, we will diagnose hernias and even potential cancers. But we needed to have a system to help these people. And it's my goal that if we screen a disease, that we're able to refer this patient to either a surgeon that can help them or another, put them on a list to help them getting the surgery later on in the year. So my expectation is that we're able to do that in this trip and get better every trip.
I think it was eye-opening and very humbling to experience limited resources, but a lot of people wanted to help.
Yeah.
And a lot of people wanted to be helped. And what that made in a way that it was meaningful, at least for me, even I was able to intervene for a moment in people's chronic process of dealing with diabetes and hypertension and chronic pain, things that are very difficult to help someone in just a snapshot, one visit within a 2-week mission. I felt lucky that I was able to be out there, not within the city of Monrovia, but outside, and yet being able to screen a few patients that actually had cataracts and they were not blind yet. And guess what? We were doing cataract surgery. And some of those patients end up going to actually get the procedure. So that felt like I made a difference. Not myself, because I was just there to facilitate someone else actually doing the job, which was preventing blindness. So, but if we were not there to see those patients and screen them and appropriately put them in the pipeline to get the procedure, they would go blind within months or years. So that's very rewarding. That was worth my trip for 10 days there. I could not stay there 2 weeks, commitments in residency and things like that. But just those 2 or 3 patients that I was able to see, I said, hey, I had a doc for you. Let's go and get you surgery. Hey, that's worth it.
And
Thank
me
you.
before becoming an anesthesiologist, I was doing surgical training. So I changed specialties. For me, I went there and I was able to help the wound care and also screen wounds that we needed to know if they needed further care in the hospital or if they could continue to care at home. So we did that a lot of in the villages. We screen off the wounds. They will send me the patients because we'll refer the patients between us, between the providers. We had an ED, pediatric emergency doctor, and everybody will refer the patients. For example, Sergey saw a cataract, a patient with a potential cataract, he will send it to the ophthalmology. If they will see a patient with a wound that they were concerned of, they will send it to me. So we were able to kind of do a little referral provider between the villages and between us.
And Daniel, how do you manage this now? Because just like Veronica said, there are so many things, right? But they are just simple ones. So someone come with a very severe illness, but then you have 3% simple illnesses that you can treat right away. How do you really decide, to say, okay, I'm going to do this, I'm going to leave this one, I'm going to do this one later? How you make that determination?
Well, in medicine, we triage patients. So, if you have 3 minor illnesses versus somebody who's in a critical condition, of course, you will look towards the patient as in critical. If we can't treat them there, like Sis Roberta said earlier, we'll gather money together and try to send the patient to JFK or to whatever closest hospital there is to give the patient the care that they need right then and there. So that's how we triage patients. Right now, for me, the momentum is getting people on board to go to the mission in 2023. Recruiting nurses, I'm recruiting people for logistics, just anybody who wants to go, I've started sharing things on Facebook, sharing things at my job, sharing things with my friends, and people are very excited for the upcoming mission.
And when you're recruiting people, where do you throw your net?
I throw my net everywhere. Everywhere, and anybody it catches, so yeah.
And I know everything. Tell me some success stories, because we'll get to the challenges, but I want to hear the good news. As you've been doing this since 2011, 2012, Joe.
Oh, okay, Uncle Joe.
Yeah, let's Uncle Joe, Roberta, Asata, Dr. Simmons. Tell me some of the success stories, and we're going to come to the challenges as well. Let's start with the success.
You're muted, Mama Robbie.
People get to see the grandchildren that they haven't seen since they were born. Their eyes are fixed. Yeah. People get to walk, because of whatever reason they couldn't walk. There's this one lady, the one that brought us this large pan of coconut, because she couldn't see, she haven't seen her grandchildren since they were born. They were like 12, 13 years old. So she was able to see them. So she came crying to us with what?
No, hold on, because I've never seen that. Someone who has not seen for 12 years, you make them to see?
She said she has not seen, all she saw was blurry, like blurry or something, but she wasn't typically blind, but she couldn't see anything. She couldn't pick up picture of any form of person. She wouldn't know if that was a boy or girl. But she saw her grandchildren and she was happy. We have a lot of success stories. The baby bottles was a lot of success. We saved a lot of babies from dying. There was a twin that we met in Baza that combined, they were 4 pounds. Combined weight, they were 4 pounds. That we put them on a baby feeding program that was in Liberia that the mom didn't know about. So, I mean, the success story is a lot. It's too much to even name. But I mean, we do have a challenge, like Joe will probably explain, or somebody else will, but the success story outweighs by far the challenges. Yeah.
Joe,
it's the fact that if you can make a change in a few lives, it doesn't matter the challenges, where you're still making a change in the people that we are having success.
Yes. Yes.
So
Let
when
me
you
let me
have these,
piggyback.
okay, go
I
ahead.
want I want to piggyback on what Rob just said. You know, if you look at the testimonials that we get from the mission, basically these are testimonials that keep this mission going, even with for all the challenges that we run into. When you listen to these testimonials, they keep you up all the time. You keep hearing these voices, and you say, "Well, I cannot give up on these people." One of the things that are actually two things, like Roberto was just saying, we went to Bommy Hills. At the Bommy Nutrition Center, we saw children being, fed with a big cup because they didn't have a baby bottle,
Newborns.
So they will force their mouth, the baby's mouth, then they just, force their mouths and just, and, feed them with milk. So our team went there. So this is a Rob cell. I literally cried. I cried. Okay. So I went and asked the director, I said, don't you have a baby bottle? So why these children have to go through all that and just forcing them? They said, well, we don't have baby bottles. So we can only, use what we have.
So men actually do cry.
Oh yeah. I am. So sometimes
I can give
they
you
refer
stories.
So, I have cried several times. There was another lady behind Kakatari called Laketa that we met.
Yes.
This lady, she lost two of her children to high blood pressure. So the people in the town labeled her as a witchcraft. Okay. So people were looking at her as a witchcraft because she lost two of her children. Now she has her grandchildren. Nobody wants to be bothered with her. She's also suffering from hypertension, okay, and diabetes. She went to the hospital. They gave her a prescription that cost almost $400 some more dollars. So she had to make that decision, and she relied on coconut. Okay, selling coconut, like a 5-10 coconut to feed her and her grandchildren. So she decided, well, it would take me years and years for me to get that $400 and some more dollars. Okay, so what she did, she said, well, I'm just going to wait for God's time, the same way my children did, because we could not afford the prescription med. And luckily for her, the Liberia Medical Mission got to Laketa. So she came and we saw her. She was so happy. All the medication that had been prescribed for her, we had them. So we were able to give her like a few months of supply. But out of joy, she took us, maybe saying that's something, that, those pictures. She took us to the bucket of coconut that she was selling that day to feed her grandchildren. She was so excited that she had to give those coconut to the team. She said, well, I'm sorry, I do not have money to cook for the team. What you guys have done to save my life, I do not have pay for you. So please eat these coconuts from me. Yeah. But someone came and I didn't want to get the coconut, Mr. Ja, but someone came and said, look, you know what? Culturally, you don't do that. Just to make her feel fine, accept the coconut. So we accepted the coconut. Then Roberta and I went there so to at least kind of know this lady. So she started explaining all of this something. Then there too, I started crying. So we because
what is dry coconut that you could eat with farina?
No, they were young coconuts.
The young coconut would be what? Oh my God!
That's a young coconut.
I've not had that in a million years.
Oh yeah. So we turned around. We went and distributed the coconut to the team. Then I explained the condition. So what we decided to do, Roberta put $50 and the other people put $20. Then so we put money together. So we went to her, not saying, well, we're buying something. That's okay. how many of the coconut that you have to sell in a day, at least to buy a bag of rice? So she started going through all of that. Then we gave her like I think it was $150 that day. We collected it and said, okay, you know what? On behalf of the team, because this is what we got, at least to give to you. Thank you for at least taking care of the team. Okay. So there are so many of that we saw at redemption. Let me tell you one thing at redemption. There was a man at redemption. This man, was doing a garden to feed his family. Okay. So we got to redemption. He said it's been 7 years. 7 years. He said, look, Mr. Sako, one of the things that are really bothering me, I've not been able to go to church for 7 good years. Every Sunday, I will sit in the house and cry. Okay. I used to feed my children, but I have to depend on other people, at least to feed me. I have the strength, but I can't see. But luckily for us, we were able to take it and say, look, you have made me to be able to go to church now every Sunday. I do not have something, but what I want to tell you is that you and your team, anything God will bless you from now. Anywhere you go, you have that blessing. Okay. At least I do not have to depend on anybody. I will have the strength to feed my family now. I will not be a liability on other people. So
and what you did for him, I didn't get that. What did you do?
He got his surgery.
Because
surgery for his eyes.
He had lost his 2 sight.
Oh, okay.
He could not see. And his frustration was that he used to do garden to sell it and feed his family. But for 7 years, he had to send children to go and beg people to come and feed him. And on Sundays, because he couldn't go to a church. All right. So every Sunday he would sit in the house and start crying.
Wow.
But thanks to the Liberia Medical Mission, we were able to at least work on his both eyes. He could not believe it.
And probably he goes to Mission for Today, because from Redemption to Mission for Today is just a walking distance. That's the church there. So, Dr. Simon, when you hear all these incredible stories and do all the work, how do you leave them to come back? What is it that you put in place so that you don't meet them worse than you left them or you met them?
That's a really excellent question. I think that's an area that we are continuing to fine tune and tailor. But some of the things that we do, at the top of the program, I was mentioning the training, educating, and advocacy is in our training. At least for me, for mental health, when I train the other clinicians, I'm leaving them with like packets and books and all this other stuff of things that they can do, tailored to, like, if your client has depression, if they have bipolar, if they have schizophrenia. So there's something tangible that they not only learn and we practice. We have lots of, I have tons of videos of us learning things together, but that they're also left with a manual. They're left with things that they can use. They're left with pamphlets they can give to people. And then my goal is always to train the trainer, right? So whatever our team is imparting onto our counterpart in Liberia, their job then is to train other people as well. So we keep our training going even in our absence. So that's one of the things that we do. Everyone may not go to school for extra 10 years to be a doctorate or whatever, but there are fundamental things that you can learn to help anybody out, So our team's job is to give people practical tools that not only they will learn, but that they can easily transfer to other people as well. So that's some of what we do. I just want to talk about success. You mentioned success stories, and Uncle Joe did a whole bunch of a bunch of them. We've got too many of them, as Mama Robbie said. We're a family, we call each other mom, dad, uncle. it's so funny that all of our minds went to the site, right? Because for me, the story that stuck out to me was more like a vision type story where this one guy came in and he had his grandson carrying him. And after the surgery, he's like, my man, leave me, man. I can see. I'll take my son to my brother. And it was like my favorite story ever because you could just see the difference. I mean, his walk was different. Like he was so empowered. So he's coming in, grandson, what I was sitting, as soon as he said, but what are you holding my hand for? I can see now. And I loved it. It's the kind of change that you can see, and it's like you take that stuff with you. You just can't forget it. For me, for like mental health, I'm just thinking about when we first started when we revamped 2013 with LMM. One of the things that stuck out to me was how people weren't as aware about mental health and all this stuff. Because they were like, oh, they can't go tell me to the woman, yeah, she just come and tell me about, how to escape abuse or what happened in my head. She didn't get no medicine for me, nothing like that. And then going back in 2018, it was a drastic difference in terms of education level. I mean, people are so much more aware, and I still get text messages, DMs all the time about, oh, I heard about that one time I did this. Oh, when you were on, like Dunia and I did a bunch of shows, when you were on the radio and you said this, I finally understand this, that, or the other. So even though, like from a mental health perspective, a lot of our work is like training and imparting knowledge. People are listening, they're taking it in, and they reach out and let you know how your work impacted them. So how do we leave without feeling completely absent? We teach so that those individuals can be teachers as well or trainers as well.
And they don't tell you and Dunia, small girl like you, what you want to tell me?
I just tell them it's genetics, Dunia was saying she was the younger one. And I was thinking, well, younger in terms of joining, but I'm the baby.
Younger in terms of joining, but I'm younger in terms of age.
next year will be 20 years. I was just laughing the other day. Next year will be 20 years since I entered the mental health field. So that this is good genes. My mom did good to me. So let's not be fooled. So most times I say, oh man, I just good genes. If I tell you my I know my business. So
we have some questions here. And this one for you, Dunia. Let me. Arthur Freeman say, can nurses go?
Definitely, nurses could go. All nurses are welcome. Certified nursing assistant, licensed practical nurses, registered nurses, nurse practitioners, nurses with a doctorate. All nurses can go. Yes, nurses can go. Nurse anesthetist. Yes, everybody can go. Yep.
I think even artists should go because at the end you need somebody to play the guitar and sing, right?
And we like celebrating. Artists are welcome too. We got dancers. We got Veronica. I still have a clip of you dancing on the beach to the traditional Liberian drum. So artists too.
When I got my hat, I remember they did me a beautiful job. I loved it.
Yeah.
A few comments here, ladies and gentlemen. If you're just joining us, this is focused on Liberia. We are discussing with the Liberia Medical Mission. They are on their way to Liberia 2023 mission, and we are talking about their work. This is, incredible. There are more good people than bad people. And I'm happy to be part of this discussion. Few comments here. This one from Kman Dix. Great job, Brother Joe and team. God's blessing is upon you all. Thanks, Dennis, for having these great men and women on your show. Rachel said, much appreciated to the team. Jen also appreciate the team. Elvis Morris, thanks, Dr. Green, for going back to your motherland and helping our people. It's well appreciated.
Oh, it's an honor. Thank
you all so much for the wonderful work you have done in Liberia. Isaac is on the train. When Isaac gets home, we're going to be watching.
I'm on the train.
Mohammed say, Auntie Dr. Wilmina Simon, that's our humble servant.
Hey, that's beautiful.
All right. Mohammed is saying congratulations. And I also want to join you all to say congratulations. Well, if you're watching the show and want to call in, we have a few more minutes left. Call the number that's on the screen, 605-313-6004. The code is 791403 #. So you're going on a mission to Liberia. And this part, I want to say call to action. What is it you want everyone watching this to do? Who going to watch later? People in Liberia, people in the Czech Republic, wherever. What do you want them to do? Let me start with Dr. Asada Kamara.
Well, getting prepared to go to Liberia 2023. I think in my trip down to Nimba in February, when I came back, I did debrief the chairman, Joe, some of the issues, because like this coming mission, I think we're supposed to spread out of Monrovia a little bit to see other areas. So when I came back, I told him what were some of the issues. Like when I was in Ban, for the first time, this boy probably born with type 1 diabetes. He's never seen insulin his entire life. So I'm like, okay, let me send the driver to go get the insulin. There were insulin nowhere to be found. So when I came back, I told him, and some of the issues in that area, like, I don't know, something is happening, because when we first went to Liberia 2011, we didn't have a lot of high blood pressure and diabetes. Now it's all over the place. So when I came back, and then now the way we are going, getting prepared, how, like Dr. Simon was saying, how we teach the healthcare worker, not to teach, but how we exchange the knowledge to better take care of the people. Because you know what? All thanks go to the Liberian healthcare workers, because we are only there for a couple of days. They are the one doing the work.
Absolutely.
Okay? They are the one doing the hard work. How we take care of them. But I don't really, just to answer the question, I don't think whether you need to be doctor or this, it don't matter. There is a need. If you cannot go, like 2020, I couldn't go. I was able to get $2. I called Joe. Joe, I got $2. I'm so embarrassed. I'm so ashamed of myself. Here go tobacco water for the team. Like some of these patients that are going to come along, we need to rush them to the hospital. We need money. I'm just appealing to Liberians from all levels. Either you got $1, you got $2. I don't think any of these people sitting here will pay $2,000 and leave job that will cost you thousands of dollars to steal your money. And it's not, it will be spent for the cost. You can't go, you got $1, guess it, take it and spend it for somebody. There is a need. We have obligation to our people, to all people, merely the people of Liberia. So if Liberians are listening, you there, you in Ukraine, Uganda, it don't matter. Anything you can get, we'll take it for you and spend it for the right cause.
Anyone can just come in. What is it that that we need? Let's talk about that. I think I missed.
We need gas every day. We need food. We need a place to stay. We need transportation. The need is great, but we manage. So far, we have been managing. But to get there, and you have a card that wouldn't take you from A to B, that's difficult. You can't do your job if you can't get where you need to get to. You can't get your job if you don't have gas to get there. You can't do your job if you have no place to sleep, and you definitely can't do your job if you don't have food. So we need help to cover all those basics. Everyone on the team paid their own way, totally, to get to Liberia. And they also, when we get there, everybody pitch in and help to do it, whatever needs to be done. When we see a sick patient that needs a few dollars, we'll start looking into pockets. So people spend their own personal money when they get there as well. I usually tell Joe, I shouldn't be calling people in the state to ask for money to travel back with, but it happens to all of us. We all do it. We need help, and I think the more help we get, the better we can serve our people, and the more we can help our people. Because sometimes we get to Liberia and we waste a day or two because we don't the things that was promised didn't come through, so we have to wait. So I mean, I'm not putting blame on anyone or placing blame, but I'm just saying, if people can hover around us and help us, that will make our job easier and make it more proficient, and we can do more with our time. We won't be wasting our time standing around. We can do more for our people. And that's what my goal is, to see us doing more with what we have, because we're going to have people that surround us to help. Financially, we need help. That's the problem. That's what keeps us. That's what keeps us struggling. Is the financial help that we need.
And
Because
you must said it right about passion, because the first question is, especially in these days where most things are transactional, is like, what is it that really drive you, that you spend your own money, and there is always an opportunity cost for everything. So if you're supposed to be working at your job, making not less than $150 per hour, you are leaving that to spend 2 weeks in Liberia. On top of that, you are paying your own money, your own way. Somebody may ask, really, what is it that drives you? What is it that you get? And
our people,
Yeah.
Let me just jump
our
in
people.
quickly. Okay, go ahead. I just wanted to mention this. Not only do people pay for their own, mission fees and stuff like that, but there are so many of these volunteers that have their own private businesses that they have to close them down. All right, they have to close them down to go and attend to these patients. Now you talk about
opportunity
call to
cost.
action. My call to action for all Liberians. This is all of us organization. It is not Roberta's organization. It's not Dr. Simmons, Dr. Zagby, Asata. None of us. This is all Liberians organization. All right. And what we are doing it on behalf of all Liberians, because we are now attending to our uncles, our own people. All right. First of all, I am calling on all Liberians.
Joe,
Nurses.
let me interrupt you a little bit, if I may.
Okay.
James Pantry is asking for Cash App so that he can help. Wankame Sandola said, thanks so much for the medical team for the hard work, watching from my Nimba Mano village. You're not in no
Oh,
village.
wow.
Let's go, yeah. We got money. I want to count it. Come on.
Jefferson Coco said,
We'll take it.
bless every member of this team. We do appreciate. So if you're watching, or what the team is saying is, if you're watching, any way that you can help, please do.
Yes.
And just like if the mission trip, those of us that are from church background, they say if you can go, your money can go, because not all of us have the training.
Yep.
Yeah, to go and
Absolutely.
perform surgery and all these things. But if you can go, your money can go. You can send somebody. So there are many ways you can help. And Joe, as you can also talk about the different ways people can be a part of this team.
Yes, I was just saying that I really want to take this time to appreciate some of the local population. Many of them have been very great. Even at times, some will just collect few bottles of water and drop them at the at the hotel. There are some individuals that will even cook at their home. There are people that will even invite the team to say, well, I want you to have a dinner with us. Okay. As a sign of appreciation. All right. So, we are calling everyone. If you are nurses, if you are doctors, if you are, CNAs, if you're LPNs, if you are photographers,
Yep.
I mean, we need, even if you are an English teacher, if you are, uh, wherever your background may be,
If you can speak
look, we
Mano to
need,
interpret to the people.
Yeah, translators.
huh?
Yep.
I say if you can speak Mano or Grego or Kran
There
or
you
Bassa.
Yes,
Awesome.
exactly. We people, okay, like Dr. Zach B and Sergey, when they are there, we have our non-Liberians that will be traveling. We sometimes we need translators. Okay, so we have a local coordinating team. Sis Clara and the rest of the team are there. But I'm just appealing. Join the team. Okay, we are going to serve your own Liberian people. All right. It is a true eye opener to go on this mission. When you go one time, your life will never be the same again. Trust me. Okay. Secondly, like you rightly stated, this organization is self-funded. We have not been fortunate enough to get a grant, and the simple reason has been that all our operations are external. Okay, so many of the grant, of the grants that come, they want their local population that are paying taxes to benefit. All right. So, but all our operation based in Liberia. So we encourage our Liberians. If you have a birthday coming up, put on your birthday something. Okay, yeah, I'm raising money for Liberia Medical Mission. But all what we're saying is that okay, yeah, I'm raising money for this huge multi-billion-dollar charity something.
I know.
What's about your own little organization that is struggling to go and cater to your people? Okay, so I mean, we need to at least support our own organizations that are doing a great job in Liberia. The other call to action is the government. We want the government to see this organization as a true partner. Okay, we are complementing the efforts of the government.
Yeah.
All right. I remember 2018 when when President Weah came into power, then he made an appeal. 1 month later, the Liberia Medical Mission was there. Okay, so we need to work together in order to improve the healthcare delivery system in Liberia. We are willing to do that. Okay, so I am calling on the government and everyone to please join us so that we can help Liberia. We can make Liberia a better place. Thank you.
Thank you so much. At this time, as we draw to a close, we're going to go around the room for your closing comments. And again, if you are watching, the website is www.liberiamedicalmission.org. You can go there and make your donation. It also have a Facebook page, Liberia Medical Mission. So if you go there, you can learn more about the mission and ways in which you can help. We also say welcome, Joanne Gray. Joanne is watching. Welcome. So let's go around the room. Let me get your closing comment, starting with Dunia. You have some trouble with the internet, so I don't want.
I really apologize for that. Yeah, I'm having some technical difficulties. But I will appeal to everyone watching to share this video on your page, just for us to be well known in the Liberian community and other communities, and to donate, for our cause, to help our people. So I thank you for watching and thank you for having us on your show. And I look forward to our next trip, 2023. Here we come, LMM.
Thank you. Dr. Veronica, your closing comment, please.
Yes, I wanted to thank you all for listening. And we make a difference in every trip, and not only in the trip, but we're constantly preparing to help people, even when we're not there. And we're welcome you also to put us in Amazon Smile. You can select a place where you want to donate your money when you buy things, and that goes a little bit to the Liberia Medical Mission. So if you don't have anything that you can support us, at least you can put us in Amazon Smile. So every shop that you do can go a little bit to the Liberia Medical Mission. Thank you for having us.
Thank you so much. Dr. Simmons?
Thank you, Mr. Dennis, for having us on your show. Thank you, everybody, for joining us. We love Liberia. It's our home. But for those of us that were born there, our neighbor string is buried there, and so we can't help but just keep wanting to go back. We appeal to not just people here in the States, but also people back home. We need volunteers both that are leaving from here, but also that are on the ground to help us out. Any bit will go a long way. We love y'all and we can't wait to see y'all. God bless you.
Thank you so much. Few comments here. This one from Samuel Tapla say good initiative. Lasana Kamara, I'm very proud of you guys. And Jen Jen says, so excited about the work being done. We need to support. And so, yes, if you are there watching, we also need you to support with some Mokovi. Good. Let's go to Asata for your closing comments.
Well, as for me, like this go to all Liberians. If you are watching, like they were saying, if you can't go, your money can go. But just think about it. Just spending like $20 to buy a blood pressure medicine for somebody for almost 1 year in Liberia to prevent them from taking stroke. What do you think of that? Another $25 or $30 can get them diabetes medication for the whole year.
Wow.
Like we
So
were
for
saying,
$50, you are giving somebody medication for the whole year.
because the price that we're going to get the medication for here is not a retail price. We have connection. The chairman have made those connections to get those medication from drug companies very, very cheap.
Wow.
But the problem is we are paying our way. We're looking for other stuff. And that's why other people are coming. Think of it, $50 to pay somebody diabetes and high blood pressure medicine for the whole year. Whole year. So they will not take stroke. If one person takes stroke in Liberia, the whole family dynamic will deteriorate.
Wow.
We don't have water to be turning people around. We don't have this big diaper. Think of it. And then we can say, okay, let's go teach them how to eat. Who will cook in Liberia? You don't put salt inside. If you don't put salt, why you come and eat? So it's very, very critical. So let the people think of it. We're not in it, like they were saying before, this is for all of us. All of us, Liberian, non-Liberian, mainly the Liberian, let's work together to help our people. Thank you.
Thank you. Let's go to Dr. Castaneda.
Castañeda. No, thank you again for having us. We really appreciate this opportunity to convey what we are passionate about. My closing comment will be probably the following. We encourage medical students, residents, professors, practitioners in Liberia to reach out to us. Let us know what you need to learn. Let us know what you would like to learn. And we have a way to share the experience, knowledge, and we'll learn together about how to make the healthcare system better for all Liberians. We have learned many things throughout this COVID-19 pandemic. No one has talked about it today, but we're still very much still going on it. And we have learned that we can help many, many people around the world. And all of us are connected, and all of us should be caring for each other. And we're doing it we're right now in Europe. You guys are in the US. We're trying to help Liberia. So it's very easy these days to get together using technology and share experiences, knowledge, and grow together. So I encourage you to reach out to us, and hopefully we can connect with more training their trainer programs, which I truly believe is what is going to make a difference going forward.
Oh, wow. It's very important you said that, Dr. Castaneda, because, and I told even my family people in Liberia, most of the time when people in Liberia ask you, they are asking for money, right? So I tell them, I say, why don't you ask for advice? Why don't you ask for mentoring? Why don't you have a story where family member of mine call and say, "Oh, Brother Dennis, I want to sell gas. Can you give me $300?" So I asked, I said, "What's the market analysis you did that make you arrive at that decision that gas is going to help you?" You know what I was told? If you don't want to help me, let's stay.
Okay.
Right? So people like Dr. Sigwa said, you should ask for help. You should ask for partnership. You can do more to benefit from the Labrador Medical Mission, even just by talking to them. Here is a student, Samuel Tapla say, "I'm a medical professional. How do I join this organization?" And I will also say to the medical students in Liberia, or even you are going to school for CNA, for a nurse or doctor, these are the kind of people you need to connect to. So as to talk to them, advise you and just work with them and get some, transfer of knowledge, both of you learning together. So I just wanted to repeat that. Sekou Sharise Labrador Medical Mission is one of the most impactful non-state healthcare operations in Liberia led by Liberians. I also talked to a group that were sending medical supplies every year. So I said, but sometimes try to also send knowledge, because just by telling someone how to clear the pathway in the hospital, you are saving lives. So it's not always about medical supplies. It's also about telling people what to do, how to do it, efficiency, process improvements, and the whole 9 yards. Let's go to Dr. Green for her closing comments.
Thank you so much again for having us, allowing us this opportunity to speak about the work we're doing. If you're interested, there's no offer too small. There's no position that wouldn't be helpful. If you feel so inclined, please reach out so that you can join the mission. Everybody is welcome. We can put you to work somehow. And I really just look forward to the 2023 mission. And again, like just establishing that connection, that collaboration with our colleagues on the ground in Liberia. So even in between missions, when we're not on the ground, we're still in communication. We're still doing education and teaching and sessions and things like that in between. So this is really just a launching point for things to continue to come in the future to improve the healthcare for all of Liberians.
Thank you so much. Let's hear from Joe. Mama Roberta will be the last. Joe, you are muted.
Okay. Well, thank you so much. Thank you so much, Mr. Ja, for having us tonight. This has been a great conversation. And let me tell a big thank you to all the panelists for taking off your busy schedule. I know Dr. Zagby and Dr. Castaneda, they are in Spain. It's almost very late there now, 6 hours different. Thank you for taking off this time to be on this show. Dr. Green, Sarah, Dunia, Roberta, and the rest of the team that are not here. To our Chief Medical Officer, Dr. Sila, I want to say thank you for your leadership. Dr. Major is not here. To the I team, and to our nurse manager, Nyento, who could not also be here. And to all of our volunteers, I want to say a big thank you. Without you, there'll be no Liberia Medical Mission. Okay. Thanks for your love for your country. Indeed, we have made significant, contributions in Liberia. I'll be remiss without mentioning a few things. During the course of the mission, we have provided more than, again, to recap, more than $13 million worth of medication and medical supplies to the people of Liberia. Okay. We have given gift of sight to nearly 300 Liberians, allowing them to walk, to see, and to, not to be a liability to the society. Okay. And we have saved more than 8,000 lives during the course of our past mission. Okay. And we have provided a workshop, various workshops to Liberia National Police, to the schools, Phoebe Hospital. The mental health team has been phenomenal as well. Another thing that I want to, as part of my closing remark, is that we have explored opportunity for a potential urological program with the University of Pennsylvania, thanks to Dr. Colbert that traveled with the mission in 2016. Upon his arrival in the state, discussed with the University of Pennsylvania to start this train-the-trainer program, so that through the Liberia Medical Mission, we could bring at least one or two doctors from Liberia that will specialize in urology. So all of these things, we are working every day and night to make sure that we improve the healthcare delivery system in Liberia. Another thing is that we have saved JFK and other places a lot of money by carrying our biomedical engineer to go and set up their diagnostic equipment, their surgical equipment. Thanks to our friend Ben Weaver, who has been very helpful, and he has been training some of our young people while he's there. Okay, so, and we have also expanded our network of medical donors from 4 to more than a dozen. Okay, and thanks to our partners in Liberia, the United Nations, the International Organization for Migration, UNHCR, UNICEF, WHO, Aminata and Sons, APM Terminal, the Office of the First Lady, Mrs. Claire Weir. Thank you so much. And the Office of the President. Thanks to the President of Liberia for letting us in, the Minister of Health, I Help Liberia, the UN Resident Coordinator Office, Freeport of Monrovia, the Kiddos International, Divine Finger Church, ACS Foundation, and the GNN front page, and the former Minister McGay and family for being there for the mission, and all the local civilians that have been contributing. We want to say a big thank you, and we look forward to seeing you. Please support the mission. Thank you.
Thank you. Joanne Gracie, I'm in for 2023. So Joanne is going. Dr. Barton Kulase, thanks Joseph Sako and the rest of the team. Please continue to impact Liberia through healthcare delivery. Psychiatry and psychotherapy are greatly needed. I'm planning a show, and I will call Dr. Simmons to speak about that before even we close, about the connection, because sometimes in Liberia we don't make the connection between a healthy society and the economy, right? There's a disconnect as to how we look at, if people are sick, we probably have not real deeply thought about the impact it has on the country as a whole. Mm-hmm. So I'm devoting in the next 2 weeks a show to the impact politics and healthcare, the economy and healthcare. That is the link. If we have a sick population, if people are not going to work, the economy is going to be stagnated because these people are not producing. I don't know if we really think about that. Dr. Simon, before Mama Roberta, I have a kind of story with Roberta before we close. I was writing on the internet and we're going back and forth, and I used to be very high-headed, politics and typing. So she will respond and everything else. So the day she met me in person, she was so surprised. There was this little guy, innocent looking shy. I said, "Oh, and you've been doing that friskiness. In fact, from today, call me Sister Roberta." I would never even respond to you again. Anytime you write, I thought you were talking about big man. So Dr. Simmons, before we go, I want you to talk about that connection. When a population is zogo, how does it affect the economy? When a population is sick, what is that link? What is that connection between a healthy population and a country that we all can say is developed or is thriving, or the Human Development Index is way up there, or the economy is booming? What is that link? Muted. You are muted. They said that was the most popular phrase of 2020, right? You are muted.
I know. I just realized it. No, I said that's a heavy conversation for a whole different day. But what I will say is that there is a clear impact. That having, we always say health is wealth, right? The same is true for your mental health is included in that health as well. And for each person that's not able to work, think about what they could be in fact contributing to society that they're not, and usually when I think of people, I think from a systems perspective. So if one person's impacted, it's not just them that's impacted, that's not given to the community, but it's also their family members that they can't also provide for. So everything that we do when we're not in our sound mind, when we're impacted in some way from a mental health or even a physical health perspective, it's really difficult to be a contributing member of society. We can get into stats and numbers, but for the sake of time, it costs billions of dollars. Okay, so we might as well. Someone said, I think it was my Ente Asata. She talked about the importance of being proactive. I think a lot of times Liberians, we find ourselves being reactive as opposed to proactive. This is a really good time for us to be proactive in terms of our health care, in terms of our mental health care, so that it don't cost us so much. We've already lost a lot. But there is a strong connection between the two. And part of LMM's mission is to try to empower people and not enable people. We are like good at enabling, but we want to empower. Okay. So that's all I'll say for now.
Thank you. And I like that keyword, system thinking. If you're only thinking about the foot and forget about the head, it's not going to work because one impacts the other. Ente, brother, you got the last word.
Well, I would like to first thank you, Dennis, my little brother, for hosting us in the first place. We covered a lot today. We did a lot. We said a lot, and hopefully people are getting the message from us, and people are going to be putting more effort and time into helping us. One thing someone told me and said, well, 85% of Liberians are unemployed. And my question to them was, of that 85%, how many of them are employable? And nobody knew the answer. So we have to start training people to be employable, so that they can take care of themselves, like Dr. Simmons and everybody else been saying. Our going to Liberia is not just to give you pain pills or to give you high blood pressure medicine. Our job is to help you help yourself. So when we're coming to make you a stronger person so that you can be able to help yourself. Asking me for money, like Dennis said, asking me for money is a short-term fix. We need to start looking for long-term fixes. We can't just say, okay, here's $10, go eat today. And then tomorrow you're looking for somebody else to get $10 from. But if I can show you how to take care of yourself and how to start a small business, then I don't have to worry about you coming to me anymore for $10. Because now you're able. So we are going to work harder to make our country better mentally, physically, emotionally, so that they can do for themselves. Our goal is to empower you for you, not to go showboat, not to do this, but for you. We want you to be the strong one. We want let us do the work and let you benefit from the work. We want you to be the strong one. So once again, we thank you all for listening to us, for being patient with us. Well, 2023 coming. Be there. I'm sure a lot of us will be there at the airport to greet us, even though we keep saying don't come. But we can't wait to see you all next year. And we love you, and we are doing this totally out of our hearts. Where none of us here are getting paid for this time that we're doing what we're doing. Thank you. I thank you all, and I see you 2023.
Thank you so much. I want to thank you, take my hat to all of you. Say thank you so much for the incredible work that you're doing. Please feel free to come back just before your mission in 2023. God's willing, we'll still be here so that we can once more re-emphasize, re-energize, and rejuvenate the team. You know how, before you go on the team to play, we go in the locker room and then we just sing and make sure that you have all the strength. The best we can do for those of you who are going is make our own little contribution. I really appreciate what you're doing. I'm happy to meet some of you for the first time today.
Dennis, we need a
you see? My God now see you. That's why
Go, go see you. Your gozo, eh? But let me just put a number on what you asked. You know, I was looking it up really quickly, and I saw that even in the states that it costs about $193 billion in lost income for our mental, individuals that have serious mental illness. That's a ton of money, and I imagine in Liberia the impact is just as critical, just on a smaller scale, because we're a smaller country. So she back now. Say a thing before I cut you off, because Mr. John had gone
I think Dennis purposely cut me off because he didn't want to
I
answer
always
my
get
question.
that. So go ahead. You got 30 seconds before we close, Roberta. Go ahead, say what you were saying.
No, I just want to say thanks to everybody for coming tonight. I'm not mute, so I want to thank everyone for coming. I seriously appreciate your time. I know we're all busy. We all have things to do. Some of us, haven't really started our day yet or our evening yet. So I just want to say thank you very much for your time. Dennis, I'm putting you on a list to go to Liberia 2023 as our journalist. And if my phone is not working, you can also be the camera person. So just so you know, you're on the team.
All right. With that, we're going to conclude the broadcast with our song that says, "We are all Liberians." Whether you are from Nimba County, Lofa, Grand Bazo, River G, we are all Liberians. What is incumbent upon all of us is to do the best in us to make our country the glorious land of liberty. Have a good night and God bless you.
We are Liberians. Liberia is our home. Liberian people. Liberia.